All right, guys, so we can go ahead and get started. First off, thank you guys for joining, logging on, whatever you want to call it. In today's day and age, I'd rather, be hosting an event at your guys' respective schools, but we're going to make the most of it today. We have two previous district trustees with us, Dr. Anna Moses and Dr. Tyler Robers. Super, happy that you guys could come on and volunteer some time to help, students understand exactly what, their options are coming out of school. Those of you that don't know me, my name is Sami, Jilla. I'm the academic relations manager for Aspen Dental Management. And Aspen Dental Management is the organization that supports all of the Aspen Dental practices across the U.S. So those things are separate. Aspen Dental Management is the dental support organization. I saw somebody already ask that question. So we're ensuring that all of the doctor-owned Aspen Dental practices have all the non-clinical support they need. So that way they're able to focus on dentistry and taking care of their patients. And if you look on the screen, I did put a link, aspendentalce.com/welcome. That's just free CE courses that are approved by the ADA that you guys, if you want to dive into CE more, anything that you're interested about, you can use that. It's completely free. So that's just something that Aspen Dental has offered. But we'll go ahead and introduce our panelists. Dr. Anna Moses. Just give us, a background about you and kind of how your journey, started and where you are now.
Sure.
Yeah.
Hello, everybody. I'm your old District 4 trustee. So 2 years ago, I was in many of your shoes in dental school. I went to the University of Tennessee, but I'm originally from Connecticut. So I'm definitely a Northeasterner who just loves sunshine. So for me, I didn't exactly know where I wanted to live, but I knew I wanted to stay where it was warm. So I was a little bit open geographically. So I started talking with Molly, who was the Sami at the time, as well as a couple of different opportunities. And I then decided where I wanted to live. So once I did that, I said, I 100% want to be in Tampa. And then I started looking for jobs, and I just really wanted to find an awesome mentor. I knew as a general dentist going fresh out from dental school, I'd still have a lot of questions as far as how real world dentistry works versus school dentistry. So every interview, I just tried to get to know who would be mentoring me really well. And I ended up hitting it off with Dr. Dickerson, who's the owner of my practice, the best. And so now I'm practicing in Plant City, which is just outside of Tampa.
Great. Then Dr. Tyler, you want to give us an introduction? You're still on mute. An intro, and then give us a fun fact about you two to end off.
Okay. I am currently in Wisconsin. By the end of the call, I might be in Illinois. My wife is over here too. But we are driving to the Smoky Mountains for our first anniversary. So that's why I'm on the road. So sorry if I cut in and out a little bit. I was the District 7 trustee for ASDA the same year that Anna was on the Board of Trustees. So it's good. We haven't talked in a while, so it's good to see you, Anna. But
yeah, it's nice to see you.
I went to Marquette for dental school. I graduated same year as Anna, 2019. So I've been working in Wisconsin for Aspen the last, I guess, almost year and a half now. I started as an MCD, which is like a lead dentist in an office right out of school. I kind of knew the area I wanted to be in, and it just happened the office, they had an office in that area that needed a lead dentist, and not a lot of people start out as lead dentists, but it just had the need. I've kind of been in a few different offices, though. I started my training a little farther north near my hometown, and then went to that office as the lead dentist. Didn't really love it there, and another opportunity opened up back near my hometown. So I moved back up, and now I'm the MCD there. My office opened 2 weeks before quarantine. So it's been fun opening back up, basically having a second grand opening. Love my team, and we're growing steadily, so that's good. And a fun fact about me, I have a really sassy 2-year-old German Shepherd and Husky mix dog that we rescued about a year and a half ago.
Awesome. Congrats on the anniversary, first off.
Thank you.
Yeah, so I think here's a good question to start off with. What options did you look into coming out of school? And then ultimately, why did you end up choosing Aspen? Dr. Anna, you want to take this one first?
Sure, yeah. So I think I kind of started to touch on this a little bit. I knew I think by the end of my second year that I didn't want to do a residency or anything and just start looking at jobs. So once I decided that I definitely wanted to be in the Tampa Bay area, I was pretty open to different practice models, and I just wanted to find the very best mentor, somebody that I could be really open and honest with, somebody that I could celebrate all my successes with, and somebody that I could lean on when things didn't go my way. So I think I came down here over my spring break, and I had a bunch of interviews lined up, some in private practice with a single doc who was looking to hire his first associate, one in a group practice that was basically like we'd all have our own patients and their associate was going to another opportunity. And then I looked at a couple different DSOs. So for me, it just came down to whoever I clicked with the best during that interview. What's really awesome is that with my owners, Dr. Dickerson and Dr. Liu, it's a husband and wife team. So I will say, just as a female provider, sometimes there's a little differences that you have to overcome. So that's nice that I can get that perspective from her as a female mentor. So yeah.
Great. That's awesome. And then Dr. Tyler.
So I had a couple different places I had talked to, but I had known some of the Aspen recruiters for quite a while and really trusted them, knew they had talked to me about opportunities, and I'm one of those people that kind of likes to just learn by doing things. So I wasn't too afraid of being a lead dentist, and they offered me that position. So I was ready to just get out there. I was same with Anna. I knew I didn't want to do any kind of residency. I just kind of wanted to learn on the job and get paid for it rather than doing a residency, maybe not making a lot of money. So that it kind of lined up with everything I wanted. I did get 3 months of training before I was on my own, so that was really nice to kind of sharpen some skills, ask lots of questions, get to know how Aspen does things.
Yeah, awesome. All right, another question here to follow up is, could you tell us a little bit about your steps after dental school before working with Aspen? Dr. Anna?
Yeah, so after dental school, I hung out with my family for a little bit. I would definitely take some time to just celebrate this awesome accomplishment that you've made it through dental school. And you don't have to dive. I mean, everyone's different. I didn't want to dive right into work. I took 2 months off. I went camping. I thought in my mind I was like going to do CE and like had these grand plans, but instead I mainly relaxed, got my whole apartment set up, and just enjoyed those 2 months, because I thought at the time that I wouldn't really have 2 months off ever again before Corona. But yeah.
Yeah. Great. Dr. Tyler?
Similar situation. I just wanted to relax. I was pretty exhausted coming out of dental school. And I was really broke. So I didn't do a whole lot. Kind of sat around
for free.
What'd
In
you
the
say?
Badlands. There's free campsites in the Badlands. So it's
Yeah.
the cheapest vacation I've been on.
So I did a lot of things at home. We had bought a house, so I did some projects at home. But other than that, I didn't do a whole lot to prepare. Didn't really do a lot of CE or anything like that.
Yeah, and like as trustees, you guys, you had your time filled up. I mean, with a lot of responsibilities. But that's awesome. So another question here, is it accepted to work for some place like Aspen for a year or two as a general dentist and then apply to a residency, or does the workplace not favor that sort of short-term employment? Dr. Tyler, you want to take that one first?
Yeah, I think there's a place for that, certainly. I think a lot of the owner docs know that there is some more turnover sometimes in Aspen offices. Obviously, they're looking for somebody that's going to be there long term, but there are those opportunities where they just need somebody, they need a doctor there, and they're willing to work with you. And who knows, I've heard of a lot of people that had those plans of going back to residency, and they get out and they love it and end up staying there. So, yeah, I mean, I would just be straightforward with whatever doctor you're talking to or whatever office you might be in. Tell them, hey, I might want to go back to residency eventually, and as long as you're honest with them and upfront, then that should be no problem.
Yeah. So another follow-up question here. What do dentists say is the best thing about working for Aspen Dental? Dr. Anna?
So I think that you see so many different types of patients immediately out of school. And your treatment planning can be extremely comprehensive. So that's my favorite part, is that our patients walk in and a lot of them haven't been to the dentist in at least 5 years, maybe even 10 years, or the other day it was 64 years. And so there's a lot of breaking down, a lot of, people fear the dentist. And I think to break down that fear for them, super awesome and rewarding when they come in and they smile and they're not like, oh, I hate being here. Instead, they're like smiling. They're like, this is a great place, and help being a part of that. But also just being able to utilize everything that you've learned and you've spent the last 5 years or 4 years studying, because there's so much comprehensive work if somebody hasn't been to the dentist in 5 to 10 years. So it's been really cool to do a bunch of different treatment plans. And I mean, just today on my way home, I have a patient, she has dementia. We have to extract number 8 and she's just not tolerating a flipper whatsoever. But her husband was like, no, we don't want an implant. So we were talking about like different plans for that. So it was cool to reach out to different docs and get different opinions on what we could do.
Yeah, and that's a huge benefit in terms of like the network that you have with other docs to work with. But Dr. Tyler, what is the best thing for you about working for Aspen?
I think kind of just expanding on what Anna said, being able to use Aspen really, I feel, has set me up to kind of do whatever I want to do. And I have like my office opened with an iTero and a CBCT, and it's kind of up to you how you want to make it. And kind of like Anna said, you can do everything. I choose not to do root canals, which is great, but I've gotten really, one of the first things that I did was training for Invisalign. And so I've gotten really interested in that. And humble brag, we were top 10 in the company this month for Invisalign. So that's something that I was always interested in. And so we're doing a lot of that. You get to do lots of extractions, which I enjoy, dentures, crown and bridge, fillings, implants. The CBCT is really nice to be able to have that right in the office whenever we need to take a better look at something. I guess just the ability to do whatever we want. And we do have implant training, and so they encourage you and give you all those skills to expand your skills.
Yeah, I think a little bit picking off, it's so nice to have the modern technology available to us. So, you know, with Invisalign, we have an iTero in every office. So I've started scanning a lot of instead of taking a traditional crown impression, I'll just scan it, and it's quicker, easier on the patient. And then you can also be really humbled by some of your crown preps, because you can blow it up and really look at what, you know, that margin's really great, or you know what, let me fix this. They're still numb, they're in the chair, you know, the cord's already packed. So
Yeah. And just to add on to that, another question here is asking, what is the scope of practice for general dentists at Aspen in terms of extractions, endo, perio, prost, peds, etc.? Dr. Tyler, you want to take that one?
Yeah, pretty much whatever you want to do. Like, we see kids in our office, if they have a lot of work or something, and I just don't feel like they'd be able to sit for all of it, I refer them out. I'll see the ones that I think will behave in the chair. Like I said, I don't do endo. We do lots of pros. Surprising number of people breaking teeth with COVID. I don't know, like, lots of crown and bridge lately.
mm-hmm.
And implants, I guess some perio. I don't do perio, but my hygienist does. And yeah, everything. Ortho, Invisalign.
Yeah, in my office, we have, so my owner, he has 14 offices in the Tampa Bay region. And I think it's a 2-hour span, and we all kind of live in the middle. So we have an endodontist that comes every other week. I think I've done one root canal, and that was just because I was like, I want to do a root canal. This is the number 6 that's already like bombed out. And then like after I did it, I was like, it's just faster and more efficient for me to refer to my endodontist. So if I can offer my patients that gold standard of care, I'm going to do that. And then we also have an oral surgeon that rotates through our office. He's there a little less frequently, but usually, you know, I'll refer, he sedates patients. So any patient that's getting an implant or full mouth extraction, or even a single tooth extraction that wants to be sedated, we'll offer that. Or if they have like a really complex medical history, I'll refer. I just got a patient who's been on bisphosphonates, so I was like, I'm not touching you. So that's nice to have the specialist come through, and it's also really nice to just be able to call them or send them a picture of a PA, or say like, hey, can you look up this patient and give me your opinion on this, to have their, you know, their knowledge at your fingertips. But we do everything. And if I don't feel, I think there's been like 1 or 2 cases where I've been like, I'm going to refer you to a periodontist.
Yeah. I think that's a huge benefit that a lot of places don't have in terms of access to in-house specialty. That's great. So another question here, just adding on to that as well, is there a time limit for speed when seeing patients as a new dentist?
Absolutely not.
Okay.
And Tyler, you can talk about your training. I'm sure every owner does it a little bit differently, but essentially how the appointments are set up is you have your own column that you run, and you have complete control and say over how long you want that appointment to be. My office had me fill out like a preference sheet of, okay, crown seat, how long do you want that appointment? Crown prep, how long do you want that appointment? You're doing 2 fillings, if you're doing 4 fillings. And then I told them I don't like to do more than 6 fillings. I get sick of it at a time. So you have complete control, and I'm constantly paging through my schedule and shortening and lengthening different appointments based on like, I know this patient's really anxious and they're going to talk to me for like 20 minutes before I can get them numb or whatever.
Yeah, that's awesome. And then Dr. Tyler, how was it for you?
Yeah, same thing. We filled out the paper. I put all my preferences. Same thing. I go through the schedule, adjust things if I want to. Starting out, though, they'll give you plenty of time, especially during training. You can kind of tell them how long you want to do certain things. And I think you'll find out, like, getting out and being in practice with like trained dental assistants and not having to worry about all the things you did in dental school, you'll just naturally get a lot faster. For me, it was nice. My training was kind of tailored. I talked to the doctor, and we were kind of on the same page that I just wanted to be kind of thrown in, and she was there to help when needed or with any questions. So I tried to run her schedule. She's really fast. And then she would just pick up the pieces where I couldn't do it. But it was, for me, it really benefited me to pick up my speed and learn a lot really quickly.
Yeah. And somebody was actually asking about the training too. So, Dr. N, do you want to touch on what training looked like when you first came on, onboarding, and kind of what that process looks like?
Sure. So for me, I was mainly, well, actually my very first day, my owner was opening a brand new practice. So that was really fun. So my first day, I didn't really do much, but kind of observed. And then after that, because he has 14 practices, I just went around with him to the different practices. And they would give me my own column of production patients. And I kind of started with maybe like easier productions. So fillings, any new patient, my mentor and I would go over the full FMX and look at all the intraoral scans before we went in there. And at first I would chart for my mentor while he was doing the new patient exam and listen to how he presented, like if he wanted to guide somebody to do an implant or extraction and implant versus an extraction and bridge, just how you would present that to a patient and make sure that they knew the differences and why you were presenting what a lot of patients think is just the more expensive option. Like you want to make more money or, something like that. And then we swapped. So he would chart and I would present treatment, and he would then be able to immediately say like, hey, when you explained this, that was like too scientific, or when you said this, I think you lost the patient a little bit. So I could get that immediate feedback, because I think the new patient exam is really the most important time. And then besides that, it's just making sure you have that quality care.
Yeah. And then, Dr. Tyler, you had a different experience coming on as an MCD. So what did that training look like?
Yeah, so I still had the training for 3 months where I wasn't on my own. I was in another office with an owner doc. And my training was a little different, just the way she did it. It wasn't quite as hands-on as Anna's. That does sound pretty awesome, but every doc's going to be a little bit different with that. I think the main thing coming to Aspen that was an adjustment for me was managing multiple columns. As an associate, you don't have to do that as much. You're more focused just on your production. But there are 3 columns that we run in Aspen. You have your production, you have new patients, and then you have an overflow column, which is like denture steps and whatever else fits in there, I guess. And kind of learning how the denture flow worked with having a lab tech in the office and all that kind of stuff was the main things for me to learn, as well as just doing as much production as I could to get my speed up.
Yeah. And just to clarify, an MCD stands for Managing Clinical Director. It just means lead dentist. But another question here is asking, how many patients do you see on an average day? I think this will vary from practice to practice and what position you're in. But Dr. Anna?
So after Corona, I actually switched offices. So first I was in our Brandon, Florida office, which is one of our busiest offices. And there was me and two other doctors. So just by the fact that there's three doctors in that office, we saw a lot of patients. I think we would get anywhere from 6 to 12 new patients a day. And then the three of us each had our own column of production. Granted, not every single hour is full of production, but our goal was to make it full as possible. So I think like production wise, maybe you have a 3, 4 in the morning and same in the afternoon.
Okay. And
Now
then,
the office that I'm in now, I think new patient wise, our numbers just aren't as high, which is fine.
yeah.
Yeah.
And Dr. Tyler, how was it for you?
Yeah, my current office, we're still building up because we're brand new. So I would say total, I see somewhere around 20 patients a day, but that's say 7-ish in production. We see 5 new patients or so, and then overflow. So like denture steps. So obviously, like denture steps are quick patients, so that's going to be almost half your patients you see, and a lot of those things only take 5 minutes. And then there's hygiene checks on top of that. But I've never felt like overwhelmed, other than like a couple days here and there. But on a regular day, I don't feel like we see way too many patients or anything like that.
Yeah. Okay. This is going back to the training, but somebody's asking, do you get paid your full salary during the 3-month training period?
So I was actually only training, I think, for like 7 weeks. But yes, you do get paid your full. You have a daily rate, and you get that daily rate. And then I think it's after you've worked for 2 months, then you start making your incentive. And the incentive is basically you get a certain percentage. So as an associate, it's 8 to 10% of the total production once your fixed expenses have been paid. So once the rent, electricity, etc., has been paid, just like any other business would be. And your incentive can be pretty generous if you're doing pretty well. So that's nice.
Yeah. And then Dr. Tyler, you want to touch on?
So my training I think mine was a little longer, being 3 months, because I was going to be on my own after. They wanted to make sure I was ready for that. And then my last 2 weeks there, 2 weeks towards the end, I ran the whole schedule by myself, and I think it was kind of like a trial run to see if I was ready to go. And yes, you do get paid your full salary. I don't think you get like bonus opportunities while you're training. But as an MCD, as an MCD, you make 16 to 20% of total production. So if you produce enough, as long as your office isn't doing that bad, as long as it's fairly busy, you should make a bonus as an MCD. Associate, I know, Anna, you probably have to be at, like, your offices are really busy, so you're probably making some bonus, but you gotta make a lot at your office.
Yeah. And again, going back to the training, so the implant training course you touched on, it's asking, will Aspen cover the cost, or will it depend on each office? Dr. Anna, you want to take that one?
Sure. Yeah. So for Aspen covers the cost. Right now it's online. And I think it's a total of, I started it. I think I did half of it so far. And then with the Invisalign training, they covered the cost for you to go up to Chicago. They flew you out, covers your hotel, and all of the CE credits. So that was also awesome because you met a whole network of dentists from all over the country. who are doing the same exact thing you are.
Yeah. And then
Yeah.
Dr. Tyler, is there anything you want to add on?
I did the whole implant course over quarantine. It used to be in person, I guess, and then quarantine forced it to be online. But yeah, it's like 2 hours a day for 2 weeks. And then there's like some pre-training that sounds like, Anna, that might be what
That's
you're
what
doing.
I did.
It was like, that
During
was very long,
quarantine.
but
Yeah.
some of it's some stuff you already know from school, but it's a really good refresher. And if you're not placing implants out of school, I know I didn't get enough training in implants in school to feel comfortable to place implants. But then kind of the next step after you take that class is you work with like your owner doc or some doc that comes to your office that does implants to kind of work together through some cases. And then there's kind of an implant continuum. Like once you place a certain number of implants, then obviously once COVID's done, there's going to be like an in-person class where you get to place implants, and then eventually they're going to have a course on like all on fours or more. In other like aesthetic cases, that's like a third step of this implant continuum. So it's really cool what they're doing with it. Obviously, a lot of it got halted with COVID, but it's exciting to know that all that implant training is going to be included. It just got to work towards it.
Yeah. And our doctor development program's always, growing and expanding. We're always looking for new ways to help grow our dentists. I know it used to be called Edge, what you guys used to go to before COVID. And then also, we're also adjusting it, the doctor development program. But did you guys both go to Edge?
I
Yep.
did.
Yeah. Do you want to just touch on what that looked like for you guys? Dr. Anna, you can start.
Sure. So Edge is meant for new doctors to Aspen. It's a week that you go to the Aspen headquarters in Chicago. And you just, you're in a smaller group. I think that there was about 20 docs there. And they have different CE courses. So one about crown and bridge, one about dentures, basically every single part. And with that, of course, there's the social aspect, which is super great. But also, you walk through different types of treatment planning and things like that. So it was I went in January, so I had been working for 6 months already.
Okay. And then Dr. Tyler, how was it for you?
Yeah, I mean, all the same things Anna said. I had worked for, I think, about 6 months as well before I went. It was great to meet other doctors, kind of share the excitements and frustrations of getting out of dental school and the difficulties we were having adjusting to the real world of dentistry. But the training was great. It was nice to kind of take a step back from the office for a second to learn some more things, because that first 6 months you're just kind of like cramming to learn as much as you can, and to kind of slow down and take a break was nice.
Yeah. And just to go back really quickly, somebody asked, is the implant course part of CE? Is it associated with a fee?
There's no fee with it. There's you get CE credit, but there's no fee on the docs.
I don't know if that's in the free. I don't think that's part of the free CE.
Oh,
if that's what they're
see.
asking.
Sorry, didn't understand the question.
Yeah, I don't think it's a part of the free CE either. That's something that we offer through our learning and development program that we have. Okay, so we're going to change gears a little bit. This is asking, looking back, what are some things you did or could have done during dental school to prepare you for your transition to the workforce? Dr. Tyler, you want to start?
Ooh, that's a tough question. I would say one thing I wish I would have done is kind of nailed down like how I want to approach I know a lot of times in dental school, I approached every appointment kind of differently. And then once you get out, you're still going to try some things, but I would try as many things in dental school as possible so that when you get out, you know what you like doing. You do a crown prep the same way every time. You do all the things kind of the same way every time, because it'll make you more efficient and your work will be a lot more predictable if you kind of figure out what things work best for you.
Yeah. And then what about you, Dr. Anna?
Yeah, so I would 100% agree. Like, try all the burrs that you want, and then figure out what 3 burrs you love for your crowns. And same thing with fillings. And because every doctor is different, we all have our own preferences, and we're all a little bit type A. We want things a certain way when we walk into a room. So I would say, if you can, for each procedure, start making a list and take pictures of how you want it set up, because then you have expectations for your dental assistants and you already know, like, this is what I want. We don't have any enamel hatchets. Can we order enamel hatchets, or whatever it is that you love? See if you can order them so that you know in your office, like, this is exactly what I want, and this is how I set up. Because the stricter you are with that, the more efficient you will be.
Yeah.
And the other thing is, I wish that I also just kind of like relaxed a little bit in dental school and like took a step back to soak more things in as far as treatment planning. Like, don't just rely so much on what your professor is telling you. Like, ask more questions, or I wish I was a little bit more independent in coming up with my treatment plans, and then asking the professor, and then delving into why.
Those are great answers, guys. Thank you.
One other thing with that, sorry, Sammy. I would highly recommend, if you're not involved in like ASDA or some other kind of leadership role, I would highly recommend getting involved and get some leadership experience, because you are going to be, whether you're an associate or a lead dentist or you own a practice, you're going to be either in the operatory, be able to lead your dental assistants, your hygienists, work with your office manager, all things you're going to like gain experience with if you get a leadership position while in school.
Yeah, all questions come to you. So you need to be able to formulate a plan and answer everything.
Great. Here's another good question. How marketable are we as recent graduates to DSOs like Aspen, and how much does class rank or GPA play a role in your desirability? Dr. Anna, you want to pick up?
Sorry, did you say Tyler?
No, I said Dr. Anna. Sorry.
So I have my owner has asked me to sit in with interviews of potential hires with him. So I guess I have a little bit of insight with this. Usually I don't see the potential associate's resume or anything. He does. But he will have me just talk with them about what we do, and then they'll shadow me, and then he just asks me about their personality. So he hires off of personality, but that's just his preference. But I will say that I know a lot of doctors who hire say that they want somebody who's positive and someone who's willing to learn. So those are the 2 biggest things.
And just to go based off of what Dr. Tyler just said, being more involved in leadership roles such as ASDA or whatnot, that'll definitely look good for an owner when they're looking at your resume. And it'll just help with your overall personality, your confidence as well. But Dr. Tyler, do you want to add on to that too?
Yeah, I would agree with everything Anna said, but I think most docs are looking for like how you do in an interview, your personality, like would you be a good fit in the office? If if you can do dentistry, you graduated, you can do dentistry. I think it comes down to a lot of those things Anna said. Are you going to be positive? Are you going to be able to lead a team and work with the staff there? I think that's all kind of the most important part. As far as are you marketable to DSOs, I think you are extremely marketable. I mean, from Aspen's sake, we seem to like hiring new grads. I think that's partly because new grads are still hungry. They want to work hard. They want to learn as much as possible and kind of get their feet wet in doing dentistry. And Aspen likes that because we have all those opportunities to teach people things and get you involved in whatever you want to do too. So I think you are very marketable.
Yeah, and I think that's why they spend a lot of time and energy and money into doctor development, just to make sure you guys are continuously growing. But that's another question here. Do you feel you've grown as a dentist since joining Aspen, Dr. Anna?
100% yes.
Okay. Okay, here's a different question. What are your least favorite things about working for Aspen? Are there any negatives or anything you wish you'd known before? Dr. Tyler?
I guess the only thing I would say is that because we do accept everyone, or like all insurances, and we have like lots of room open for new patients, and we accept anybody who wants to be a new patient. Sometimes when my office is slow, I get like a really high number of just emergency patients that really don't want to do comprehensive care at all. They're just there to get their one tooth taken out and be on their way, and we'll never see them again. I mean, that's good too. I like getting people out of pain, but sometimes I see like a lot of emergency patients, and that kind of bugs me. Well, more so because I'd like to help them with everything else.
Yeah.
I call those the one tooth wonders.
Oh, that's a good name.
Yeah. For me, I think, well, one is in my region, we're open once a month on a Saturday, and I'd rather not do that. So I'm working this Saturday.
Okay.
But yeah, I mean, the new patient exams are free with Aspen. And so every now and then you do get those patients who it's like, okay, your hygienist goes in perio charts, your DA took all the full FMX, Pano, a scan, and then it's like been 45 minutes and you go to do the exam and they're like, you look at everything and they're like, but I'm just concerned about this one tooth. And you're like, okay, that's fine. I can focus on that one tooth, but then, you know, what are we going to see you for this one down the road? Stuff like that. Yeah.
Yeah. Okay.
And sometimes you can win them over. Sometimes you do, but not always. Today, I got a 2-tooth wonder.
Okay. All right, here's another one. What does a new dentist find frustrating? Dr. Tyler.
Oh man. Dealing with difficult patients, I guess, was one thing that really frustrated me at first, especially being a lead dentist. I didn't have like another doc in the office to like an owner doc that was around that could deal with the patients if I couldn't answer their questions or things like that. So you do learn quickly how to deal with those difficult patients and kind of stick to your guns, because there are a lot of patients that'll come in and kind of demand certain things of you or try to tell you what their treatment plan needs to be. And that was pretty hard for me at first. I have a hard time being like a mean person, or like in my eyes mean, and being stern about it. So that took me some adjusting to like stick to my guns and not just do what the patient wanted.
Yep. And Dr. Anna, what about you?
I mean, dealing with difficult patients is pretty hard. I think, man, I had a really good answer for this, and then Tyler made me forget. Oh, I remember. Okay, I think that in my first couple months when I was like on my own, I definitely had some cases where I underdiagnosed, and I thought maybe I could do like an indirect pulp liner, but definitely needed that RCT, and that was difficult to me because I felt like, gosh, I told this patient they needed a filling with a liner, which is this much money, and now they need a root canal and a crown, and it's this much money. So I always feel the patient's wallet with my heart, and it makes me hurt sometimes.
Yeah. Okay, another one here. What are the advancement opportunities at Aspen? So I guess we could highlight the stages that you can go through. Dr. Tyler, you want to take that one?
Yeah, so most people start off as an associate. And so obviously you have a lead dentist working over you or an owner doc. And then you can move up to an MCD or lead dentist in the office, which means you're basically, if like you're in an office that the owner doc isn't there, you're in charge of everything that the owner doc would be in charge of, making sure the schedule's right, if any decisions need to be ultimately made. In my case, I've never had an associate in the office with me, so I was the only doctor there. And then you can move up from there. You can partner in an office, which means you buy into ownership with the owner doc. And then if the opportunity arises, you can buy full ownership in an office too.
Yeah. Dr. Anna, is there anything you want to add on to that?
I think Tyler covered it pretty well.
Okay. All right. Another one here is when a new graduating dentist encounters difficulty with the procedure for a patient, does the lead dentist step in to help them? Dr. Anna, you want to take that one?
Yeah, I think that's just up to you. I mean, I remember my first or second week, I had a really tough extraction and my hand was hurting. So I just excused myself for a minute, and I got the other doc in the office and I said, hey, I'm struggling. Can you help me? And they came and helped me. But that's only because I asked. I think, they're not going to like push you out of the way and be like, hey, this is mine. I think the best mentors are the ones that want you to learn, and the ones that want you to, sometimes you have to struggle a little bit to make it over that hill or whatever it is. And that's how you learn. That's how you get better.
Yeah, absolutely. Is there anything you want to touch on, Dr. Tyler?
Not really. I mean, if you ever like struggle with extraction's kind of the main one, I guess, is where you might get to that point where like, I don't know how to get this tooth out, or I even had a patient today. I'm like, I just can't get them numb. I don't know what's going on.
That's the most frustrating.
Yeah. I pulled every trick I knew that I could do, and I still couldn't get them numb. So you'll learn how to deal with that, like how to address that with the patient, what you need to do to follow up, do you need to put them on antibiotics, those kind of things. And it's all part of the learning process too, that you learn how to handle those difficult situations. But it is nice when you're first starting out to have that doc there that has that experience and can step in and help you, or if you don't know what to do with that patient, they'll certainly guide you on what to do.
Yeah. Okay, so there's been a few questions that came in about the differences between Aspen and private practice and other DSOs. I know, Dr. Anna, you interviewed for different DSOs and private practices. The question specifically asks, how is Aspen Dental different from Heartland? I personally don't know that much about Heartland. So Dr. Anna, do you want to give us some insight?
I actually I didn't interview with at Heartland, so I don't really know. I have a lot of friends that work for Heartland though. So the biggest difference I know is that Heartland, you can name your practice whatever you want, and with Aspen, it's named Aspen. Um, I mean, I'm not really sure how Heartland specifically differs. I think the new patient experience is a little bit different, actually, from what my friends have told me who work there.
Yeah. Okay. And then in terms of private practice, do you know how we would differ a little bit?
Yeah, so when I interviewed at different private practices, the one where it was like a group practice, they basically were like, yeah, whenever a new patient calls, we just like take turns on who gets it, so to speak. But with that, it was basically like you're only being paid off of what you are doing and what your specific hygienist, like the hygiene checks on your specific with your specific hygienist. Whereas with Aspen, say you have two hygienists in the practice, it's not like one's with me and one's with the other doctor. We can both go in and do those hygiene checks. And your incentive is really based on a team effort. So at the end of the month, when I'm incentivized, so that means like I'm making my bonus. It's based on the hygiene production, your production, the other doctor's production, if there's a doctor in your office, another doctor in your office. So as a whole team. So I kind of like that aspect because everyone wants to do well and everyone's trying to provide the best quality care to as many patients as possible, rather than just saying like, hey, I'm going to do fillings in the morning, I'll do 4 and 2 in the afternoon or something like that.
Yeah. Do you want to add anything, Dr. Tyler?
Yeah, I would just say, like, wherever you go, whether it be Aspen, Heartland, any other DSO, private practice, just make sure you get to know, like, the office, get to know the people you'll be working with before you go there, because, like, even within Aspen, every office is going to be different in how it runs and what the office culture is like and everything like that. So it's going to just make sure you like know what you're getting into. I would recommend it, like trying to shadow at that office multiple times if you can before you go there, because I didn't necessarily do that for my first office that I worked with in Aspen, that I was going to be the lead dentist for. And it just like, once I got there, the office culture was terrible, and it just was not a good fit for me at all. So that didn't work out, but it wasn't like an Aspen issue. It was more of like, it just wasn't a good fit for me at that office, and I should have done some more research or done some more shadowing to figure that out beforehand. As far as private practice goes, everything's going to be different. I do have some classmates of mine, friends of mine, that went into private practice after school and ended up doing basically whatever their owner doc didn't want to do. So basically just a whole bunch of fillings. They were even doing prophies. Some of them were working at a different office every day of the week. So like I said before, just make sure you know what you're getting into and that you're comfortable with that. And anybody that doesn't tell you the truth of what's going to happen or sound shady about it, make sure you ask lots of questions.
Yeah,
The
absolutely.
other thing I realized that neither of us really talked about, I think the biggest difference of working, I think really probably for any DSO versus private practice, is the business aspect of it. So, if we want to hire a new front desk staff, we say, hey, we're really busy. We need another front desk staff person. And then somebody else takes care as far as finding people for us to interview. And we get to interview the people that work in our office, which I love because I want them to mesh with my personality and the office culture that I've worked so hard to build.
Yeah, absolutely. And that's my job. So like I said, I work for, Aspen Dental Management. Dr. Anna works for Dr. Dickerson, who's her owner. And I'm finding the best candidates from District 4 schools. And I will present them to Dr. Dickerson, Dr. Anna, and they will interview them. It's completely their decision who they want to hire, who they want to extend an offer to. My job is just to really make their job easier. Like I said before, but those are great answers, guys. Thank you. So another question here is asking, charity and giving back is something that is very important to me as a dentist. Does Aspen provide any opportunities for that? Dr. Anna, you want to take that one first?
Yeah, I think that's something that I also feel really strongly about. We do have a day of free care for veterans. Unfortunately, because of Corona, that didn't happen this year. So I didn't get to partake in that. Tyler, did you?
No, I think it was canceled.
Yeah, I think it was canceled because it was supposed to happen when like America shut down. But there's also opportunities to go abroad. Aspen organizes some trips, and I think that you do have to work for a year before you can go on that trip. They're pretty popular to apply to go on, but I've gotten emails about that. And heck, every now and then, it's just at my own discretion. My owner's pretty flexible. If somebody's like really crying in pain and they just can't afford it, then we'll pop on a huge discount, or I'll just say, you know what, let's just not even charge you today. And I think you do that sparingly, because I've learned that sometimes that does come to bite you. For us, it's nice to be able to get somebody immediately out of pain.
Yeah. And then Dr. Tyler, is there anything you want to add on to that?
Not really in particular. I think Anna hit all pretty much everything.
Yeah, we have like a whole department that is strictly focused on missionary work and philanthropy. And I actually got a chance to host an event in Augusta with the Dental College of Georgia with the Mouthmobile. And it's just, an RV that contains 2 operatories. And like Anna was saying, like we provide free dental care for that day to all veterans in the area that are able to come out. The local like Aspen dentists will just come and volunteer for the day, and that just travels throughout the U.S., providing free care for that day wherever it's stopping. Okay, another question here. It's kind of going into the business aspect of it. How involved are you in the business aspect of the practice? Dr. Tyler, you want to take that one first?
Yeah. Being MCD, I am more involved. You can really be as much or as little involvement as you want to be. I really enjoy that aspect, and that was kind of one thing that drew me to Aspen. Is I kind of knew I'd learned that business aspect of dentistry too. There are metrics that you can look up for pretty much everything you do in dentistry that'll tell you how you're doing in certain areas. I look at that almost every day just because I have always been a numbers person, so I like to look at that. Business wise, they'll go over all of your numbers at the end of the month with your regional manager, kind of tell you areas you can improve, opportunities you're missing out on, or all those kind of things. And like Anna said, with hiring, firing, all that kind of stuff, you can be as involved or not involved as you want to be.
Yeah. And then Dr. Anna, is there anything you want to touch on that, or how is it for you?
Yeah, I'm not a numbers person at all, but I'm really competitive. So I still look at that same page that he was talking about, where you can look up like different data based on your office, and it compares you to other offices. So I'm always trying to outrank my friends. And in fact, Tyler and I are in a group text with a couple other people, and sometimes I think we'll brag on ourselves. But my favorite thing is on our schedule, just from a business aspect, to make sure it has like a number that you should be producing that day. And sometimes that number is red, which means you're not producing enough, and it'll be red saying like you're short by $1,500 or whatever. So I'm like, okay, we have a new patient and they need an XRP. Let's try and treat it today so that we can be on budget for today. So I like making that number green if it's not.
Yeah, and these are all things that, just to make sure that, at the end of the day, a practice is a business. And some people kind of see it as like we're pressuring you, but we're really just providing you with healthy recommendations in terms of what the office needs to be successful. But just to add on to that, do you ever feel pressured in terms of over treatment planning or that sort of thing?
No. I think that was my biggest fear, is to make sure I wanted to have 100% autonomy over my patient's care. And that's exactly what I get. Any new patient so there's 2 doctors in my office, me and Dr. Patel. Any patient that I see, I normally see through for all of their treatment. And sometimes we'll both be in the doc's office and the new patient x-rays will be up, and we just look at the x-rays, and sometimes we disagree. Dentistry's got a lot of gray areas. And just whoever's treating that patient has final say in what type of care they're getting. So I never feel pressured, no.
Yeah. And then Dr. Tyler, is there anything you want to add on to that?
Yeah, nothing to add. I haven't ever felt pressured to over treatment plan or anything like that.
Okay, great. So I do want to be respectful of both of your guys' time. Again, thank you guys so much for taking an hour to really explain a little bit more about what Aspen's all about and kind of your guys' journey. But that's going to wrap it up. I put the CE registration link right there if you guys want to look into that a little bit more. Somebody did ask, when did you apply for your job? A few months before or more? When did you connect with a recruiter? My email is right there, and I'm going to email everybody that registered. So if you guys are wanting to shadow a practice, or you have more follow-up questions, or you want to talk to a clinician, just reach out to me, and I'd be more than happy to help you guys. Whether you're a D4, D1, whatever, I'm more than happy to help. But just in closing, Dr. Tyler and Dr. Anna, do you guys want to add anything else?
I think just enjoy dental school as much as you can, and take some time in between dental school and working, and enjoy your life.
I would say along the same lines, just stay positive. This world we live in today is a little crazy, and I'm sure dental school is extra stressful at these times. So stay positive, you'll get through it, and it's better on the other side.
It is. And anybody can feel free from District 4. If you need my contact information, Sami, you're welcome to send out my email.
Okay.
And if not, Christina has, the District 4 trustee, she has my contact information. So I'm always happy to chat with anybody.
Yeah. Thank you guys again so much. Dr. Tyler.
And if anybody wants to move to Wisconsin, we have a lot of doctor openings coming up too.
Yeah, somebody asked about loan repayment. That's actually one of the ways you get it, by moving into hard to fill positions. Typically, the owner doctor will offer that incentive. But if you're looking to go to somewhere like Tampa, you're probably not going to get offered student loan reimbursement.
No.
But again, you guys can ask me more questions. I'm an open book. They're open books. We're more than willing to help. Dr. Tyler, enjoy your weekend. Again, happy anniversary to you both. Dr. Anna, enjoy work this Saturday. But all right, let's log off. Thanks again, everyone. Take care. Stay safe.
All right. Have a good night.
Bye, guys.